Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
30-second self-traction for neck pain, pinched nerve, herniated or bulging disc.
Self-treatment, Bob. Once again, we want to show these our viewers. You know, that's why they're here, to find out if they can help themselves.
Right. Try some things
with something simple. And this is a simple, a real simple technique that, you know, we got to go through a little explanation and then we'll demonstrate it. But Bob, there are some people out there.
Hi, welcome to our channel. If you are new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and like us, because Brad and I, as children, right, Sam? We were picked on, we were bullied, so we're trying to turn things around and become liked.
Yeah, so anyways, we think it's working.
Yeah.
So, the neck. Okay.
All right.
Traction on the neck. Why would you even consider doing some traction on your neck? So we need Sam for the model.
Sure.
And we need to look a little bit closer at the cervical vertebra, and even more importantly, the cervical.
So we have 7
discs.
Yeah, we have 7 cervical bones here, basically, vertebrae. That the first 7 make up your neck.
Right. So let's see. We got Gumby in the way there. We better look on this shoulder. Can you zoom in on this, Lonnie?
You're zoomed.
All right. So if you look at these yellow nerves, they look like pieces of spaghetti. That is actually your nerves that come out, and they ended up going down into your arm. So all the lower nerves on the neck, cervical spine, go down into your arm. They are not cut off like this. This is just strictly a model, but they do end up going down. So if these nerves, any one of these nerves can get a little pinched or irritated, it can cause pain in the neck and the shoulder, down in the arm, oftentimes in the back shoulder blade area.
And sometimes, you know, the hole that they come out of there, that foramen, over time might get a little narrower because of arthritis.
Right.
And so if that nerve gets inflamed and flared up, there's less room in that hole, so that can send pain down the arm. So if we can make that hole bigger, that's going to help.
Relieve the pressure, relieve the pain.
Right.
The other thing is a disc could be bulging or pushed into that foramen and squeezing it. So there's a number of things that could cause a pinched disc, but we're going to look at one simple treatment and see if that'll relieve it. Okay.
And in all cases, whichever one we mentioned, if you pull the neck apart, you can take some of the pressure off.
Right. Now, we're not going to, you know.
You want to show it on here, Brad?
Yeah, let's look at that when we talk about squeezing that one of those nerves. If it happens to be by a disc, and we have, let's say this is C6 and C7, a couple of your lower vertebrae, and the green ball represents a disc. Okay, now here we got the disc, and the nerve would be coming out here. If you have a bulging disc like this that's squishing into the nerve, and I pull up on this top vertebra, watch what happens to that disc. If I pull up and give it some room, go back in where it belongs.
Yes.
Okay. So bulging, put a little traction on it, get that in, pressure off the nerve. Life is good.
And then a lot of times, if I can say, take it even further, a lot of times if you can pull it back, then if you go back like this, you know, that's the basis of the McKenzie technique.
Right.
Is, you know, do traction, and then you can do McKenzie, and that helps push it and stay in, hopefully.
Right. Yep. So that's, you know, extending on one step past our traction technique. So let's, should we look at the technique, Bob?
Well, let's first talk about how would you maybe test to see whether or not.
Very good point, Bob. And this is, you want to do it to me, or
Sure, I'll do it to you.
So this is one thing Bob and I'll do just to assess, to see if traction may be a good option.
Very simple to understand. I'm going to push down on his head, and if that makes his symptoms worse, that means that, you know, compression is maybe part of the cause here.
Right.
So I usually just grab like this, Brad, and I push down. I don't push down real hard.
Nope.
But I just see, you know, did that bring on any symptoms?
Right. And the other thing, before that happens, I need to be up tall and straight, good posture, you know, and the, you know, therapist needs to be always aware of that.
The other one is I just grab, you know, on the occiput here, back here, and underneath the chin here, and I pull up straight like that, and I'm looking to see whether or not the symptoms decrease.
Right.
So now if you pull his head off,
That'll decrease the symptoms.
Yeah, that'll decrease the symptoms. So
it doesn't take much pressure to go up. If it works,
yeah,
I've always find they say, "Oh, does that feel better?"
Right.
I mean, it's pretty clear. And once you notice that, it's like, well, this can be a treatment they can do at home.
Right. If it feels worse, obviously, when you pull up, that's not the answer.
Right.
Then.
You'd simply stay away from it.
Right.
Okay. So let's say we press down. It may or may not make symptoms worse, but we go up, and it clearly feels better with some pressure. Then we're going to try this. You take a towel roll, go corner to corner, and flip it around like that, so you got something there. Should we show this on Sam?
Sure.
So what we're trying to do, and it works quite well, if you got a lot of hair, you have to get your hair out of the way, but we're getting around the occiput, this part of the bone, and we're going to go here. Oh, Sam, we're getting pretty close, aren't we? Stay away. Okay, and we're just going to pull up like this, putting that traction right through the neck. How does that feel, Sam?
Feels pretty good.
Excellent.
I could see it in here. You know, it'd been kind of funny if we'd have popped his head off. Yeah. With that, but,
Okay, so there's two ways to do this. You can do this in a seated position, which you could try right away. Let me see, I'm gonna go.
probably to the side. Huh?
Yeah.
Let me get
there we
Sam
go.
out of the way here.
So good posture. Your head is gonna be up, and you're gonna pull in this direction, and you're straight up. And I got some traction, and I don't have a neck problem, but it still feels good. So from the straight on view, I'm going to pull like this. Okay, now the direction you pull, you go straight up, you could go a little bit forward, maybe a little back, a little bit to the right, or a little bit to the left. And the way you're going to know which way to pull is whichever way makes it feel
Gives
better.
you relief.
If you have some symptoms in the shoulder and the arm, what you're looking for is the symptoms more in the arm to go away. So if I did this, and I pulled, my right arm was having pain and numbness, and I pulled up this way and a little bit this direction or this way, whichever way makes the arm feel better, that's the way I'm going to emphasize and pull more in that direction. It's going to make it feel better, and it's going to make it feel better right away while you're doing it.
I wonder, Brad, if you are having pain in one arm, if it's possible that you could get a long enough towel that you could grab it with one arm.
Sure, yeah.
I mean, I don't know if that's...
That is a problem.
Right.
Could be a challenge with self-traction. Is if your arm pain is quite a bit, that may not be an option if you don't have it. But you could try with
Going
one
like
arm.
that, yep.
Yeah. And the 30-second, the only reason I have, well, one of the reasons I have for 30 seconds, because after 30 seconds, you get kind of tired.
Yeah. So
the other thing you can try is laying down, and you may need to get to the edge of the bed. Holy cow, is that a tip?
there we go.
And we can simply do it this way. And this way is actually a little easier. And I'm going to hold that.
And again, I bet you could do that with one arm, couldn't you, Brad?
Sure.
I mean, yep.
Yep. There you go. And, you know, you could do it so your head is resting and pull.
And you look quite stylish, too, Brad,
Oh, yeah,
I
thank
might
you.
say.
I do. I feel like getting a hairdo or something. But, again, you're only going to continue with this is if it clearly makes you feel better while you're doing it, and then after you're done, you may go 30 seconds, 3 repetitions, and it feels good each time. And then when you're done, you put the towel down, it continues to feel better.
And you could do this throughout the day.
Sure.
I mean, you could do this every hour if you want.
As long as it feels good while you're doing it, and for the, you know, afterwards, yeah, you're going to repeat it frequently.
And then eventually, again, you could probably start going to the McKenzie technique where you actually do the traction, and then after that you try to bring the neck back like this, and that might help hold things in place,
Right,
the gains that you make.
right.
And it's the same thing with that has to be painless. I mean,
Right.
if it's causing pain when you do it, it's not correct for you.
And for that, we got some good videos to go more into detail on the McKenzie.
Yeah, because when we're
neck.
talking about pain too, we're going, especially if the pain's going down the arm, the pain should go out of the arm when you're doing these. If it's actually making the neck feel better, but the pain in the arm is worse, no.
That's a red flag. Just discontinue the
You want
whole
the pain to
treatment.
retract up the arm and into the
Sure.
upper cervical spine there if you're going to have a chance here.
Right.
So.
Good point.
By the way, Brad, remember, you know, we can fix just about anything
Well, that's
in
a
our
good.
mind.
Yeah, in our mind. Except for that.
Broken heart.
Yeah. Bring it in.
But we're working on it. You know, I'm thinking I'm going to get my degree in cardiology pretty soon, and so thanks for watching.